Sorry for being late, folks, but it's good to see everyone. Particularly our neighbors, our church leaders, our faith community, and our respected media folks. I mean, this is an important issue, and I'm so glad that you all are here to help promote it and to recognize National HIV Testing Day. Now, Linda has a lot more to share, but we're happy that the Health Bureau is definitely part of this event and in some respects leading the way with a lot of health partners in the community. Dr. Hawk and Barb Kovacs are always on point helping us to keep things out in the forefront for our community. So Cliff is going to hate me now because he can't hear me, right? How about I put it right here? Okay, all righty. We have a proclamation. I'm learning this, right? Yeah. It's only been about, what, 20, a while now, yeah. So,
you're doing great.
Thank you, sir. Proclamation, National HIV Testing Day, June 27, 2012. And we're doing it early because we want people to start thinking about it, start talking about it, start getting tested at our churches, everything that you're going to talk about when I'm done doing my part. So I'll keep going. Whereas the medical condition now known as HIV and AIDS was first detected in our country 30 years ago, and the HIV/AIDS epidemic is now entering its fourth decade. Wow. And whereas in 1995, the National Association of People with AIDS launched the National HIV Testing Day campaign in response to the growing number of HIV infections in communities of color and other heavily impacted communities, and organizes annual National HIV Testing Days in partnership with the Federal Centers for Disease Control and Prevention and other national and local entities across the country. And whereas mayors of our cities are uniquely well placed to help their constituents understand that all Americans need to be tested for HIV to safeguard their own health and help bring the epidemic under control. And whereas this unique and effective program created by people living with HIV and AIDS sends the message that prevention and control of HIV is a community as well as individual imperative. And whereas we strive to increase the number of those informed about HIV and to make effective treatment options more readily available so that fewer new cases of HIV will occur. Now, therefore, I, C. Kim Bracey, Mayor of the City of York, do hereby proclaim that June 27, 2012 is National HIV Testing Day, a day for York City residents to seek out voluntary HIV testing and counseling to learn more about their status and to take control of their lives. And be it further resolved that this proclamation and copies hereof are presented to the National Association of People with AIDS in appreciation of their concern for and dedication to people living with HIV and AIDS. Given under my hand and sealed, the City of York, this 15th day of June, in the year of our Lord 2012. C. Kim Bracey.
Thank you.
Thank you, Lando. And again, I know you're going to say more, but we appreciate the leadership of the Health Bureau, obviously the community. Our City Council member Joanne Borders is here with us this morning as well. This is something the city supports and it is firmly behind. So whatever we can do today and beyond, we're doing it, more than just wearing the ribbon, but we're here to support your efforts in this work. And we know you do a great job too, so thank you very much for what you do.
Thank you. Thank you.
Closer here so he can get you, that would be wonderful.
Okay, in retrospect to this proclamation, I'm just going to inform the city, give them a few stats here. Okay, according to data provided to the Bureau by the Pennsylvania Department of Health, 29 new cases of HIV infection fell upon our residents in the city of York in 2011. Here at this specific office, we've tested 279 individuals and 9 tested positive, giving us a 3.3 positivity rate. And when you think about the entire state of Pennsylvania, and as I said before, they only have a 1% positivity rate, so those rates are quite high. So in respect to that, we decided to mobilize our faith-based organizations, and we are, on Saturday, June 16th, the Maranatha Church of God, Paulette Hawkins, will be hosting a yard sale at Jefferson School, and we will be conducting testing there between the hours of 9 and 3.
Is that Lincoln School? Lincoln School, Madam?
Oh, it's Lincoln School. Okay, I apologize, Lincoln School. Okay, on Wednesday, June 27th, the City of York will be hosting an all-day testing event here at York City Health Bureau, and that would be at 435 West Philadelphia Street between the hours of 8 and 4 p.m. And the same day, Family First Health will be hosting an all-day event at 116 South George Street, and that would also be between the hours of 8 in the morning and 4 p.m. On Thursday, June 29th, Shallow Baptist Church, Reverend Pastor Jazz will be hosting a testing event in their new residential home located at 754 West Locust Street, and that would be between 1 and 3:30. So we recommend everybody to come down, get tested. Our motto for this year is Know Your Status. It's very important that you get tested at least once. Thank you.
Great. Thank you very much. Any questions, Aaron? You're it, ma'am. Not. I mean, you know what it is.
Can you talk about the tests? I mean, what they involve, how long it takes to get the results?
Good question.
Okay, we're going to be doing rapid testing here at the Health Bureau. I believe at Family First Health as well, and it's a 20-minute test. You get your results the same day.
And what does it involve? Do you get pricked?
No, actually, it's an oral test, no swab. That's what we do here at the Health Bureau.
So if I show up and get tested, do I wait around and get the results 20 minutes later, or do you call me later? How does that
No,
work?
actually, what you do is you spend the 20 minutes with me, and we discuss HIV prevention, ways to prevent acquisition.
And then you get your results 20 minutes later. Is that how that?
That's correct.
Okay.
20 minutes later.
At the other sites you mentioned, will you be doing the quick test, or will you be doing the or a short test that you get the results at a later time?
At the sites in the field, we'll be doing oral short testing. What I'll do is collect the specimen, bring it here, bag it up, and then submit it to a larger lab for results. When I get the test results, I'll contact every individual by phone so that they could come here to this office to get their test results.
Okay, so there's two different kinds of tests.
Yeah, there's actually 3 different types of tests, but we're going to be using those 2.
And the reason why I wanted to differentiate is that in our office settings, like Family First Health or here, we're licensed to do the quick test, but you can't, you don't take those quick tests out of the office into the field. So when you go to churches or health fairs and other places, you have to use the test that takes a little bit more time to get. And there's also a blood test, but we don't use that too much anymore. We use that more for maybe confirmatory tests or something like that. But usually for the screening, people want to know, you just do the oral test.
Okay. So the events next week, the tests next week that are in the offices, like Family First Health and here, it's the quick test, the 20 minutes oral swab.
Right. I don't know exactly the one that they use at Family First Health. Connie could answer that.
Okay.
At Family First Health, we use the Unigo rapid HIV testing, which is done by a finger stick, which renders a 10-minute result.
Okay.
And if that test is reactive, then we will do a confirmatory test by blood draw, and then we send that out. We do pre-counseling and post-counseling as well.
And then if people go to the one like at Maranatha or at Lincoln School, that takes longer to get back.
Well, yeah, because it is a specimen that's collected and then brought here and submitted to a larger lab.
Are we talking another oral swab?
It's oral as well.
Can you talk a little bit about the statistic that you shared was from 2011? How does that compare? Can you get a little bit bigger picture in terms of how the city compares to the state, to the country? Is there an HIV/AIDS crisis here? Is there? You said we have a higher rate. Can you talk about why?
Okay. Well, we don't want to call it a crisis because I'm sure, I don't have the actual numbers of all the tests that were conducted for that year. So I really can't give you a rate on the 29 positives that were tested here in the city of York, because you have to think York Hospital does testing, Family First Health, and we do testing. So you have three huge organizations that all do testing. They could have tested 20,000 people in that year, and you had 29 positives. And then, of course, to get a rate, you would have to, do the math. But it is a large number. Dr. Hawk and I have asked the state for a breakdown in HIV numbers. And it's a considerable amount of new positives, but that's what we do. We locate the new positives. These people are infected. They just don't know that they're infected. So by getting tested, what we're doing is we're giving them that information and telling them you are positive, you need health care, and that's what we're trying to do. We're not trying to see this as a mini epidemic or a pandemic or anything like that. We just want people to know, to be aware of their HIV status, and if they're positive, to come in for health care.
So the new numbers might be attributed to more testing that occurred, more awareness?
That's exactly what it could be. It could be an increase in testing throughout the city. And that's why we located 29 people, which is great. That's what we're here to do.
Although with HIV obviously being a highly contagious and easily spreadable virus, isn't there a concern though with the more people you find that have HIV, those numbers can rapidly? Well,
HIV is not highly contagious and it's not easily spread. It's transmitted through sex and through blood-to-blood contact. And I don't think you have that with everybody that you come into contact with. So it's not that easily transmitted as most people would think. People that have it need to know, like once again, they need to know that they are infected and they need to address that infection. As far as a reservoir of people who are HIV positive, when people know that they're HIV positive, they have a tendency of protecting their partners. So that's the beauty of knowing your HIV status, so that you won't transmit that infection to others. Because I would like to think that people are not deviant, and that if they know that they have an infectious disease that is transmitted through certain ways, that they will not do that intentionally. Most of the time HIV is transmitted, it's transmitted unintentionally. People just don't know their HIV status.
Do you know anything beyond the 29 cases that are earlier than that? Because I think you said it's comparatively high, but I'm having a hard time understanding what are we comparing it to?
Okay, well, the cases prior to that, 2010, I believe it was 22 cases.
But you said also that I guess there's more testing being done, so that could be why.
Right, because there was a wonderful initiative started by Family First Health, which is called expanded testing, where they test everybody that walks in through their doors.
It's routine testing during a clinical visit. It's offered to each individual, and which is a great thing because it does allow people to know what their status is.
Is that testing mandatory?
No, it is not. No, it is not. It's offered. They can agree to be tested or not.
And Linda, can you?
No, I was just going to sort of give a different perspective. Correct me if I'm wrong, but I think the last time I saw CDC mentioned or estimated that there's approximately, is it 40,000 new cases of HIV infection every year?
Well, It was, and now it's increased to 56,000 new cases of
Going the wrong
HIV
way. It's going the wrong
each
way.
year. So,
But see, I think that's a frightening statistic also, because we haven't made a big dent in that yet, and we've got to try harder to bring that. We've got to go the other direction. 40,000 is still too many. 35,000, 30,000. We've got to get that down, and the only way we can do that is by identifying those people who don't know that they're infected yet.
Exactly.
And so, but that to me is a frightening statistic. It's just so many, and we're already 30 years into this epidemic, and we haven't whooped it yet.
But don't you think, thinking in terms of, even though it's increasing, that more people are more conscious of getting tested now than they ever were, and they're agreeing to submit to being a protected person and going to go out and get tested rather than people being afraid to be tested, and they're more accepted to say, yes, I want to know. And I think because of the awareness is so vast now that people are more conscious of trying to say, I need to know. And that we need to look at too, because we can look at it like it's rampant, but we can also look at it like more people are being more conscious about themselves and the community. Yes.
The tests are not usually free, or not always free though. I think that's a big part of it. So what can you talk about? I know the tests this coming week are free, and I think that's probably a big important point. So does the city always offer free tests?
Yes, we do.
Okay.
And when you say free, it's at no cost to the client, but it's definitely not free.
And I think again with the mayors across the country putting awareness to this issue in their cities, and again partnerships with other health entities, make that the case so that everyone can get tested, as Mr. Ann was saying.
Okay, so the city always offers free.
Absolutely.
As long as we get the grants, right?
Okay.
For 2 more years.
2 more years in this grant cycle.
And you said the same thing.
Yes, city family personnel.
What plan?
Is that just for city residents?
No.
It's county
When
too?
when it comes to HIV, we do not have a border. You can come from another state and come here to get tested because you think that you feel that you don't want anyone in your state to know you whether or not you might test positive. You can come here and get tested. We'll accept anybody and everybody.
Great. Thank you again for the work that you do, Family First.
You're welcome.
Thank you, community residents. We appreciate it very, very much. We're going to get these numbers down in our lifetime, Dr. Hall.
In our lifetime.
Thank you.
You're right.
We appreciate it.
Thank you.
You're welcome.
Thank you.